While the additional emergency funding cannot come soon enough for many hospitals facing increased demands from the COVID-19 pandemic and decreasing revenues. And Catholic hospitals are no exception. Joining me now on Skype is Jim Sifuentes, Senior Vice President for Mission and Community Development at St. Anthony Hospital in Chicago. Jim, welcome to the show. We appreciate it.
Thank you, Tracy.
I know that St. Anthony's is a small hospital serving the west side and the southwest side of Chicago. How has the coronavirus affected the communities that you serve?
We've been really impacted. We're a safety net hospital that's been serving these communities for over 125 years. And what we would say is we're one of the hot spots. An example of that would be in the state of Illinois, the positive rate that when they're doing testing is 20%. In our area, it's when we're doing the testing at St. Anthony Hospital, it's close to 55% of the patients that we have are positive.
Jim, can you talk about how the hospital has been impacted financially?
Incredibly so. Even prior to this, because we're a safety net and we serve the marginalized, we're always looking for resources and making sure that the state of Illinois provides those resources, which is a battle in and of itself. Now we're in the midst of a pandemic. And for example, the first wave of federal money that came in really was minuscule as the amount of money we got. And the reason for that was based for Medicare. We have a population about 17%. So what we've got was a drop in the bucket, so to speak. 60% of our payer is Medicaid. We have a 4% commercial payer mix. And so the monies that are needed for us at this moment are critical in order to be able to not only provide the services to the community, but also to maintain our nursing. One of the challenges we're facing right now, an example would be Chicago opened up the field house to provide care for patients in overflow. Well, what happened is they started to provide incentives to nurses that are double, triple the amount of money that we could never even compete with. And so some of the nurses, for example, we have 15 nurses that left St. Anthony Hospital. 13 of those nurses were ICU patients, and they left because of pay. And so in order for us to continue to serve the community in the way we have with high quality, we need to be able to get the resources allocated to us. And even though we're officially not a hotspot, we're advocating to say that we are, because we have a lot of community members that are the essential workers that are working out in the communities and continuing to work. To add to that, those essential workers are coming back home. The spaces that they live are cramped. So when people say, you need to go to a room and kind of keep isolated and quarantined, they don't have that capacity. And thus we have family members that are coming in, 2 or 3 brothers and sisters that are infected with the coronavirus.
Jim, I know you described your hospital as a safety net hospital. Are you at all concerned that the current situation is going to limit your ability to continue care for the populations that you serve, many of whom I know are dealing with underlying conditions like high blood pressure and diabetes, making COVID-19 so deadly?
Very much so. Look, we are in a space where we have to battle to get our story out there. We are serving the poor. You would think that they would use us as a model. And here's why. Many people would think you're a safety net hospital. What kind of quality could happen there? According, and this is CMS data, we are ranked #1 in Chicago amongst all hospitals in total hospital performance. So that would say that our quality outcomes, our patient satisfaction, patient experience, and our cost efficiency is #1. Given the population we serve, the reimbursement that we get, which is minimal, and to be able to continue to provide high quality is incredible. So are we concerned? Without a doubt. Are we making sure that we are innovative? We are. We're turning, for example, 4 of our surgery rooms are now COVID rooms. We have 51, as of today, 51 patients that are either positive or possible positive. For sure, 41 of them are positive.
Well, Jim, thank you so much for your time. We really appreciate it. Jim Sifuentes, Senior Vice President for Mission and Community Development at St. Anthony Hospital in Chicago.
Thank you, Tracy.